Hi ma'am, I'm Anjana. I'm doing my BSc in Visual Media in Amita School of Arts and Sciences, first year. And ma'am, I would like to ask, could you please tell me what are the causes and reasons for urinary infection, and what are its preventive measures to be taken, because it has become common among the youngsters.
Urinary infection, it is usually caused by poor local hygiene and inadequate fluid intake, and even she can get recurrent urinary tract infection if she is having diabetes, that is uncontrolled diabetes which is not treated or detected. Then it can be induced by catheterization when it is done under low aseptic precautions. So prevention is by cleaning the local area, cleansing the local area, and drinking plenty of water. Her fluid intake should be increased, and she should evacuate her bladder at frequent intervals. And if any condition, like any medical condition which causes urinary infection, she has to diagnose. She has to go to a doctor to get treated.
Okay, hi ma'am, I'm Nandini, first year media student from Amita School of Arts and Science. Well, my question is, what are the causes for missed periods, because it's one of the problems faced by teenagers today.
Okay, missed periods, it is also called as amenorrhea, and amenorrhea, again, it is divided into primary amenorrhea and secondary amenorrhea. Primary amenorrhea is a condition when the girl, she does not attain periods even by the age of 16 years, and in secondary amenorrhea there can be some other underlying cause which causes the amenorrhea, like PCOD, which has already been discussed, and tubercular endometritis, premature ovarian failure. Mainly in the reproductive age group, when a lady she is having a missed period, we have to suspect first is pregnancy. Next, any climatic changes can cause missed periods or amenorrhea. Any food habit changes, any stress, and lifestyle modifications, or sudden weight gain or weight loss, or any, if she is doing any vigorous exercise, or if she is breastfeeding, and or if she is on any contraceptives like injectable contraceptives, or if she is in the perimenopausal age group, or if she has already attained menopause. Also, in case of thyroid diseases, she can have missed periods, like in hypothyroidism.
Hi ma'am, my name is Ashruti and I'm first year media student from Amita School of Arts and Science. My question is, what happens during a menstrual cycle and how long does it last?
In a menstrual cycle, there are many body changes which occur. Actually, there is increase in hormone level in the body, which especially the hormone which is very much essential for a lady is estrogen. So it has many effects, like it has a protective effect on the bones, it is cardioprotective, and it thickens the lining of the uterus. So along with this, there will be maturation or development of the eggs in the ovary. Again, what happens is, in a 28-day cycle, that is in a normal cycle, on the 14th day ovulation occurs, that is, egg leaves the ovary and it enters the fallopian tube, where in case if it fuses with sperm, fertilization occurs and an embryo is formed which gets implanted to the uterus, resulting in pregnancy. But in case if there is no fusion with the sperm, there will be shedding of the lining of the uterus, which we see as menstrual blood.
Hello ma'am, I'm a final year student of Amita School of Arts and Science. My name is Darshana. My doubt is that breast cancer is very prevalent these days. Can I know how can we home check it? What are its symptoms?
Breast cancer, it is very feared, one of feared disease nowadays. It is the second most common cancer in females, and breast self-examination is a must for every lady after the age of 30 years. So she can usually do it in a well-lit room, and it is usually done after her periods. Every month she should do it after her periods. She should check for any skin changes, any redness, any discharge from her nipple, and she can examine for any lump or any mass over her breast by using the palm or the flat of her hand and not the fingers.
Like when they find a mass or swelling in the breast, like do they have to meet a doctor very fast, or?
They have to actually. It can be if she can't differentiate whether it is a malignancy or whether it's a cancer or it's a normal. Sometimes there will be normal cases where only lump is there, so or a mass is there with no discharge, no skin changes. Still, she has to meet a doctor to rule out whether it is a cancer or not.
Suppose if it is a cancerous swelling, what is the treatment of that?
If it is a cancerous swelling, first we have to confirm whether it is a cancerous swelling. Only towards the end stages there will be skin changes, and some people will have discharge from the bloodstained discharge from the nipples, and there will be tenderness, that is pain while touching, and an evident mass is felt over her breast, but this should be confirmed by using a mammography, which is done usually in women after 30 years of age, and if any history of malignancy in her siblings are there, like mother, sister, if they have history of breast cancer, they can go for mammography, and once it is confirmed, there is surgical management for breast cancer.
So thank you, doctor. Thank you so much. It was really informative talk.
That's all for today. Write your suggestion to us. Our email ID is